Let's start. Questions 14 to 22. Complete this summary using the list of words A to Q below. So it means that we have to complete this summary by using the following words, and words are from A to Q. And the title of the passage is Graying Population Stays in the Pink. Graying population means old people, and stays in pink means that the old people are happy, healthier, and independent. So this is the title of the passage, and in this passage we will read about the old people who are happy, healthy, and independent. Write the correct letter A to Q in boxes 14 to 22 on your answer sheet. A research carried out by scientists in the United States has shown that the proportion of people over 65 suffering from the most common age-related medical problems is. So we have to find the proportion of people. This is the main key point for the question number 14, and the second main point is the United States and people over 65. Research carried out by scientists in United States has shown that the proportion of people over 65 suffering from the most common age-related medical problem is. So it means that a research was carried out in America in which we have to show the proportion of people over 65 suffering from medical problems or diseases. So for the world proportion, they may be increasing, decreasing, lower, higher, 5%, 10%, something like that. So we have to focus on these words in the passage when we will try to solve the question number 5. And that the speed of this change is. So for the word speed, they may be written in the passage the word rate of, and this change means the falling number of patients or declining number of patients. So we can say that the rate of this falling number of patient is. So here we have to show the number of patient is increasing, decreasing, growing, or lowering, and that the speed of this change is. So we have to show the speed of declining number of patients. Let's try to find the answer for the question number 15. And the data confirms that the rate at which these diseases are declining. So here we have read the word the rate, and the rate is written for the word the speed. That the rate at which these diseases are declining, it means that these diseases are decreasing, continue to accelerate. Accelerate means fast, increasing. So we can say in simple English that the rate of these declining diseases is continuing to increase. So we have to find the world rate increasing in the list of options. Caste, undernourished, disabled, nutrition, medicine, health, falling earlier, more education, pollution, independent, technology later, increasing. So we have found the world increasing, so we can write the word increasing for the question number 15. It also seems that these diseases are affecting people, question number 16, in life than they did in the past. So the main keyword in sentence is in life. So we have to find a sentence in the passage which ends at the word in life. And the second keyword is diseases. Elderly people are growing healthier, happier, and more independent, say American scientists. The result of a 14-year study to be announced later this month revealed that the diseases associated with the old age, so old age is the keyword, are affecting fewer and fewer people, and when they do strike, it is much later in life. So here we have found the word in life, and before the word in life the word later is written. So we have found the answer, that our answer will be the word later for question number 16. And this word later is also written in the options. So the word later is also available in the given options from which we have to choose. This is, we mean, the decline of diseases which we have read earlier in the passage. This is largely due to the developments in. So the word development is the key word here for question number 17. And for the word development, there may be the word progress, advances, and something like in the passage. This is largely due to developments in. So we have to find any field or area in which large number of development is done. Let's try to find the answer for the question number 17. It really raises the question of what should be considered normal aging, says Kenneth Manton, a demographer from Duke University in North Carolina. He says the problems doctor accepted as normal in a 65 years old in 1982 are often not appearing until people are 70 or 75. Clearly, certain diseases are beating a retreat in the face of medical advances. So here we have found the word advances, and in the question section we have read the word developments. So advances is a plural word, and developments is also a plural word. So we can see that certainly clearly certain diseases are beating a retreat in the face of medical advances. So the field in which the improvements are done is medical. So we got an idea that our answer may be medical, medicine, or medical related fields. And here we have also read the word beating a retreat in the face of. So it means decreasing. Beating means decreasing. Clearly, certain diseases are beating a retreat in the face of medical advances. It means that due to the medical development or improvement, certain diseases are decreasing. So we can say that this is largely due to the development in medical field, in medicine, in medical area, in science. So let's try to find our reasonable option. Caste, undernourished, disabled, nutrition, medicine. Oh, here we have found the word medicine. So we can say this is largely due to the development in medicine. And reason why we have chosen this option for question number 17 is that here we have read the word medical before the word advances. So advances is the similar word for the word developments. So we can say this is largely due to developments in medicine, but because the word medicine is written here, not medical written here, so medicine is the similar word meaning for the word medical. But other factors such as improved, question number 18, may also be playing a part. So the word other factors is the keyword, and the word improved is also a keyword. We may read in the passage the word improvement, progress, something like that. So when we will read the word improvements, progress, scientific advancement, we can get the feel that after these words, our answer will be for the question number 18. But there may be other contributing factors. So here we have read the word factors, and we also read the word other. And in the question, but other factors, it means our answer will be after this. Improvements in childhood nutrition. But there may be other contributing factors, improvements in childhood nutrition. So we can get the idea that our answer is improvements in childhood nutrition. So we can write one word, not two words. So our best option is that improvements in nutrition, not childhood. So let's try to find the option in the option section and try to find the word nutrition. Caste, undernourished, disabled, and nutrition. So we can write, but other factors such as improved nutrition. May also be playing a part. Increases in some other illnesses may be due to changes in personal habits. And to question number 19. So the key word in this question is increases in some other illnesses. So they may be the names of some diseases in the passage. We have to be careful about that. Maybe due to changes in personal habits. So personal habit is also a keyword, because the increases in some diseases is due to the change of personal habits. So we have one factor due to which the number of diseases is increasing, and two, it means the word and to suggests that we have to find the other factor also. One is the changes in the personal habits, and we have to find the other factor due to which the number of diseases is increasing. On the downside, the data also reveals failure in public health that have caused surge in some illnesses, an increase in some cancers and bronchitis. So here we have read the word an increase, and in the question we have read increases in some other illnesses. So for the word illnesses, here it is written cancers and bronchitis. An increase in some cancers and bronchitis may reflect changing smoking habits. So here we have read the word changes, and in the passage we have read the word changing, and for the word smoking is written personal, and habits is written here in the passage, and it is also written in the question section. Increases in some other illnesses may be due to changes in personal habits, and two, so we have to find the other factor due to which the diseases are increasing. And so here we have found the word and what is written after the word and? Poor air quality. So this is our answer. So let's see in the option section whether it is written poor air quality or pollution or bad air, something like that. Cost, undernourished, disabled, nutrition, medicine, falling earlier, more education, pollution. So here we have got the word pollution, and pollution is the answer for question number 19. The research establishes a link between levels of question number 20 and life expectancy. So the word research is the keyword, because the research is establishing a link between levels of. We have to find the levels of something, and the other thing is given, and life expectancy. So we can say that the word life expectancy stands for the prediction about the lifetime. The research establishes a link between levels of and life expectancy. So the word link means relation, contact, or correlation. The research establishes a correlation between levels of and life expectancy. Let's go to the passage and try to find the answer for question number 20. One interesting correlation mental uncovered. So here we have read the word uncovered. Uncovered mean unveiled. So here the word is written for research purpose. So we can say that Menton showed his research, Menton published his research. And in the start we have also read one interesting correlation. So the word correlation is written for the word link. The research establishes a link between levels of. One interesting correlation Menton uncovered is that better educated people are likely to live longer. So here we have also read the word better educated people. One interesting correlation Menton uncovered is that better educated people are likely to live longer. For example, 65-year-old women with fewer than 8 years of schooling are expected on average to live to 82. And it means that if a 65 years old lady has got the 8 years of school education, it means that he will live 82 years. So we can say that the education is related to the age of the people. It was published in the research. So we can say the research establishes a link between the levels of education. So let's try to find the answer. Caste, undernourished, disabled, nutrition, medicine, health, falling earlier, more education. So here we have got the answer, and education is in the options. So we can write the word education. And in the paragraph we have read the word better educated people. So when we read the word better educated people, then we got the idea that our answer will be education. And the second clue is that life expectancy. So here we have read that one interesting correlation of Menton covered is that better educated people are likely to live longer. The word likely means prediction, chance. It means that Benton showed in his research that if people have better education, so there is a chance, there is a prediction that they will live longer. So we have read in the question section the life expectancy. So for the life expectancy, we have read in the passage the word likely, which means prediction or chance. It also shows that there has been a considerable reduction in the number of elderly people. So the writer is saying that the research also shows that there is a decrease in the number of elderly people who are. So we have to find about the condition of people, that the people are also old, but we have to find the condition of the people who are educated, who are working, who are active, who are disabled, something like that. It also shows that there has been a considerable reduction in the number of elderly people who are. The survey also assessed how also. So we have read the word the survey and also. And here we have read it also shows, means survey also shows how independent people over 65 were and again found a striking trend. Almost 80% of those in 1994 survey could complete everyday activities ranging from eating and dressing unaided to complex tasks such as cooking and managing their finances. That represents a significant drop in. So the word drop in means decrease. That represents a significant drop in the number of disabled old people. So we have got our answer, and our answer is disabled, and word drop in means reduction, decrease. So the word reduction is written in the question section. So it also shows that there has been a considerable reduction, and in the paragraph we have read the word drop in. Drop in means decrease and reduction means decrease. There is a reduction in the number of elderly people who are disabled. And in the option section, option G is also disabled, which means that the involved in supporting this section of population may be less than previously predicted. So the word supporting means helping with money or helping with finance, which means that the involved in supporting this section of population. This section of population means disabled old people, may be less than previously predicted. It means that the poor disabled people are not supported with money or finance as they were supported in the past, as it was predicted that they have to be supported. Let's try to find the answer for the question number 22. So if the trends apparent in the United States 14 years ago had continued, researchers calculate there would be an additional 1 million disabled elderly people in today's population. So the researchers have concluded that in modern days the number of disabled people must be 1 million. According to Menton, slowing the trend has saved the United States. So Menton says that the number of disabled people has slowed down. The number of disabled people is decreasing in the United States. Government's Medicare system more than $200 billion. That government is spending $200 billion on the disabled people, suggesting that the graying of Americans' population may prove less of financial burden. So the graying of American population means the old people of America may prove less of financial burden than expected. So here we have found the word expected. So expected is the key word in the paragraph, and in the question section the word predicted is written. So predicted is the similar meaning word for the word expected. So we can say that our answer will be in this line. So suggesting that the graying of American population means old people of America may prove less. So here it is written the word less. Let's see, is it written in the question section? So here we have found the word less. It is the second clue. Less of financial burden. So here we have found the word financial burden. If it is written there, then our answer is not financial, and if it is not written in the question section there, then our answer will be financial, cost, money, financial help, something like that. So which means that the involved in sporting, which means that the involved in sporting, which means that the money involved in sporting this section of population may be less. Any, the writer is saying that we need less money to help the poor people of America than previously predicted, as it was expected, because we have read the word expected in the paragraph. So we can say that here we can write the word money, financial support, cost are helping with money. Let's try to find the answer. So the option A is cost. So it means we can write the word cost, because cost is related to money, financial help, which means that the cost involved in supporting this section of population may be less than previously predicted. And in the passage we have read the word financial burden, and financial burden is the similar meaning word for the word cost.